Senator Murray's fault.
At all.
It is not Senator Wyden's fault. So make your own deductions. Okay, and I want to thank both of them, our ranking members on Help and Finance, for doing the fabulous job that they are doing. Now, when the White House passed their health care bill, a bill that President Trump called mean, I thought it wouldn't be possible for the Senate Republicans to conjure up a bill even worse than that one. Unfortunately, that is what they have done. Meaner. Can you read it? Do I have to color it in?
Yeah, you do. That stands for emergency room, too. So.
Yeah, right. How's that? Right there. Meaner.
Another
Okay.
career as an artist.
Okay. The Senate version of Trumpcare is even meaner than the House bill. There's a lot to unpack in this bill, but its general outline is very simple and very clear. And they're getting up and saying this is a draft, but I asked Mitch McConnell on the floor, you may have seen it, is there anything that I said, which I'll say now, that is not in that draft? And he just sat down. He didn't answer, so my guess is it's all in there. The bill takes dollars out of health care for millions of Americans and puts them right back in the pocket of the wealthy. It cuts health care for those who need it most, just to give a tax break for those who need it least. Senate Republicans with this bill are proposing to defund Planned Parenthood, to drastically slash Medicaid, which helps middle-class families with loved ones in a nursing home, and sends those dollars to the very richest people in America. Senate Democrats have been poring over the bill now that it's come out from behind closed doors, and here are just a few of the things that this bill will do. First, it'll cause health care costs for middle-class and working families to go up. By cutting back on tax credits and making Americans pay even a bigger percentage of their income for their premiums, they're going to send costs soaring. Second, the bill will kick millions off Medicaid by making even deeper cuts than the House bill. If you're a middle-class family with a loved one in a nursing home, the cost of that care is going to go up. Third, it abandons people with pre-existing conditions, putting at dire risk maternity care, mental health coverage, by allowing states even more latitude to get out of covering essential health benefits. Fourth, it defunds Planned Parenthood, making it harder for millions of women to obtain the health care they need and deserve. Now, why are they doing all this? To provide a giant tax break for the wealthiest Americans. Simply put, the bill will result in higher costs, less care. Millions of Americans will lose their health insurance, particularly through Medicaid. It's every bit as bad as the House bill, in some ways even worse. The president has said that the Senate bill needed heart. The way this bill cuts health care is heartless. The president said the House bill was mean. The Senate bill may be meaner. The Senate Republican health care bill is a wolf in sheep's clothing. Only this wolf's teeth are even sharper than in the House bill. Somewhere in America, Mr. President, there's a family who takes a trip each Friday to visit Grandma or Grandpa at a nursing home, who sacrificed all of their savings to pay for their health care until they had no more savings, and now they rely on Medicaid to help pay the cost of long-term care in the nursing home. Somewhere in America, President Trump, there's a father who is eaten up inside, watching his son struggle with opioid addiction, who knows in his heart that his son would be able to go on and live a healthy and fulfilling life if he could only afford treatment to get him out from under the devastating addiction. Somewhere in America, there's a parent whose child has cancer, a mother and father who stay up late at night worried that their insurance will not be available or run out before their family needs it most. In that America that my Republican friends envision with this health care bill, those Americans and many more beside might not get the coverage they need. We live in the wealthiest country on earth. We're proud of it, as we should be. But surely we can do better than what the Republican health care bill promises. Every American should be asking their Republican senators one simple question this weekend. Why do the wealthy deserve a tax cut more than we deserve health care? Senator Murray.
Senator Schumer, thank you. Senator Wyden. Today it has really become abundantly clear exactly why Senate Republicans have been hiding this Trumpcare plan from patients and families, from Democrats, and even from many Republicans, because based on what we are now learning, their Trumpcare plan is every bit as bad as what the House passed. It is mean, to quote President Trump, meaner, it is heartless, and it is an enormous broken promise to people across the country. They're ashamed of their plan, I believe, and rightly so. After 7 years of refusing to work with us as Democrats on actually helping families get better health care, of obstructing progress, playing partisan political games, even when it hurt their own constituents, what Republican leaders have put forth is truly shameful, and it needs to be stopped. And I have to say, it speaks volumes that only today, with just days to go before they plan to vote on their Trumpcare bill, did Republican leaders think it might be a good idea to release their plan, which would impact the health and well-being of people nationwide and nearly a sixth of our economy, just today. Now, of course, Senate Republican leaders have done everything possible to prevent people from seeing their version of Trumpcare. It has been truly unprecedented. There have been no hearings, no scrutiny, no public input, and it's clear why. Because they did promise to lower health care costs, and this plan will actually raise them, especially for seniors and those with pre-existing conditions. They promised not to pull the rug out from under patients. This plan will take away coverage. They said that under their bill, no one would be worse off. Well, tell that to a woman who is going to have to pay as much as $1,000 extra for maternity care, or will have to see her Planned Parenthood center shuttered. They said their bill would protect patients with pre-existing conditions. Read the fine print of this bill. This plan is a backdoor way to put those patients' fate in the hands of insurance companies. The Senate Republican Trumpcare plan is every bit as bad as the version patients and families rejected in the House. And let me be very clear, if Republicans jam through this plan, they will own the consequences. Now, I know many Senate Republicans have said they are not happy with this secret process Republican leaders have been conducting. They want more time to review the plan, and they understand what it means for the people they serve. Well, my message to each of them is saying you're unhappy is not enough. Saying you're frustrated is not enough. You have the power to do something about it. So I urge my Republican colleagues, join Democrats, tell Leader McConnell you want more time and you want an open debate. Do the right thing for patients and families like those that have come to the Capitol to make their voices heard all of this week. All those people who've called and emailed and posted on social media who deserve the opportunity to fully scrutinize this plan. We call on those Republicans who just say they're frustrated and this is a bad process. Do the right thing. Tell Leader McConnell to stop. Thank you.
Mr. Leader, thank you. The leader and Senator Murray have said it very well, and I'm just going to make a couple of extra points. In my view, the Senate Republicans are trying to con Americans into thinking that they are fixing problems here when in fact what they're doing is causing new ones. The reality is they basically double down on everything that the American people rejected the first time around. And what's clear, and we saw it in the discussion on the Senate floor this morning, is that Senate Republicans are going to keep telling Americans they're fixing their health care right up until the second when it gets taken away. Now, the president said this was all about finding heart. That was what he really wanted to see in this effort in the Senate. It doesn't strike me as heart to put at risk not just seniors who depend on nursing homes, but let me lay this out because this is my background. If you have a baby boomer, for example, who has had a stroke or maybe early onset of Alzheimer's, they are going to find it very difficult to afford long-term care. And this bill is going to make it harder for them to get Medicaid. And it's not just seniors, and it's not just baby boomers, but it's kids with special needs, disabled folks. I mean, that's what this country has always stood for, that we would be there for folks who didn't have clout, folks who didn't have big, powerful lobbies on K Street. We are not going to turn our back on them. And I want to close with two last points. One deals with substance and one deals with the matter you heard about on the floor. The Republicans have tried to twist and distort a provision that I wrote in the Affordable Care Act to allow states to offer innovation waivers. And there are very strong consumer protections in this, so that states are given the right to do better under current law. What Republicans are clearly trying to do is to gut those consumer protections that we insisted on and really turn back the clock and strip Americans of their rights. One last point deals with this morning. There were comments made to the effect that somehow Democrats were disinterested in working in a bipartisan way. That's what I've made my focus in my time in public service on, is working in a bipartisan way. And our colleagues very much on the Finance Committee wanted to work in a bipartisan fashion with respect to the Affordable Care Act. We know that there are ways, and the leader has outlined this with respect to the private insurance market, in which we can strengthen it. Not once have I or my colleagues been asked by a single Republican to work on this bill or discuss fixes, bipartisan fixes, to the Affordable Care Act. The statement this morning that Democrats refuse to work with the other side is not just a fiction, it is a gross fiction, and you probably get my sense of the drift on that. Thank you, Mr. Leader.
One point I'd add to Senator Wyden, they put reconciliation in on January 4th. They put in the budget, they don't want Republicans, they put in the budget, they don't want Democrats to work with them on January 4th. So much for bipartisanship. Green tie.
Can you mentioned that your concern is that this bill does not protect coverage for pre-existing conditions. Can you talk about that a little more in specificity and why you believe your read of the bill?
My read of the bill is very clear, that that people will not have the protections of pre-existing conditions. There are opt-outs in there, so we'll go back to the time when people want to buy insurance and find out that it doesn't cover what they thought it did, and believe me, people don't want to go there, or they will not cover pre-existing conditions. In one way, by not covering them. In another way, by charging them more. So all of a sudden you find out if you want to buy maternity coverage or mental health, you're going to have to pay as much as, $1,000, like I said, for maternity care to get that coverage. That is not what we have today. They're taking away coverage for people.
Yes.
Senator Wyden's take on this. One of the provisions in this bill are propping up stability in the markets. They put tens of billions of dollars over the next 4 years for states and counties that, where they say, you know,
It's not
insurers have left. I mean, how do you address that issue? I mean, that's their approach, but how do
current
you
law, they
address
should just do it.
that issue where those states or counties don't have?
Yeah, first, they don't need it in the bill. It's current law. They can do that right now. So it's nothing new. But second, you can't destroy the whole foundation and then say you're going to patch a hole in the wall. It's just the whole construct will collapse around people who need health care. And a small amount of salve isn't going to help. It's not close to enough. It's what they're trying to do here. This is a nasty bill. And they're trying to cover it up with little things here and there. So, you know, states won't require, those states that asked for additional Medicaid won't be required to drop out instead of, 2020 later. But they start cutting Medicaid immediately. It's, they're trying to disguise. If they had the courage of their convictions, it would be a totally different bill. And they'd say, hey, yeah, we're cutting Medicaid. We don't think the government should be involved. That's what they really believe. But they know the American people don't agree with that, so they come up with these little subterfuges. Yeah.
At this point, Republicans have came out of their meeting saying that states can choose to keep the expansion if they want. They just have to pay more for it. And I'm wondering what your thoughts are.
Well,
It speaks for itself.
Yeah, the states are going to pay more for it, and we'll have more analysis on this shortly. But overall, the Medicaid cuts are deeper. This whole construct, this whole arrangement is set up to try to give people a sense that they have fixed all this stuff from what went over so badly with the American people. And the reality is that on key issues like Medicaid, and that's why I mentioned the kids and the baby boomers and all of those who are walking on an economic tightrope, overall, the cuts are going to be deeper.
I think people who have coverage, say to help their senior citizen parents in nursing homes, aren't going to say, well, maybe the states will give it to us after the feds cut it off. That's small consolation.
Governors.
On the Medicaid, as long as you and I have been here a long time, both parties have been talking about entitlements reform and have never been able to there seems to be a bipartisan desire for it, but they've never been able to do it. Do you think the Medicaid program does need to be changed, and is there a way, should it be done on a health care bill, and is there a way to do it where you're not
Well,
helping these
they're not trying to change it. They're just trying to cut it. We're always willing to look at reforms to make it more efficient and effective, and we've done that through the years. But this is not reform. Basically, if you talk to some of the people, the most conservative, they don't believe there should be Medicaid at all, and this is a step to eradicating it.
Can I add one sentence to what the leader said? Not only are we open to reforms, but Democrats, if you look at the last few years, have been very supportive of the idea of introducing a bigger role for the private sector in Medicaid. So we have been there, and that was why listening to all this about how Democrats don't give a whit about working in a bipartisan way is just a fiction. And on your point, we have a history of working with Republicans to bring the private sector into a bigger role in Medicaid.
Last one.
Democrats have talked repeatedly about wanting to improve Obamacare, so why haven't Democrats put forward their own plan?
We have.
Oh, my
We will
God.
send you a letter
Yep.
we sent about a month ago, signed by every one of the Democratic senators, saying, work with us. Here are the changes we propose to make ACA better. What do you propose to make it better? We got no answer.
Senator Schumer, before you
That's
go.
it. Nope.
Thanks.
President Trump just talked about the tapes. Senator Schumer? He said there's no tape, Senator Schumer. Do you have a response to that?
See what I missed when I
He
was
just tweeted it. He just tweeted the minute tapes. He said he didn't make